Hello and welcome to IPO Central. My guest today is from Gaudium IVF and Women Health. It's a company that's into women health care, and their IPO is opening on Feb 28th, closes on 24th, price between 75 to 79 rupees per share. It's a total issue size of 165 crores, which includes a fresh issue of 90 crores. And joining me today is Dr. Manika Khanna, who is the chairperson and MD of the company. Dr. Khanna, hi. Thank you very much for joining us on ET Now. Ma'am, can you take us through your business model? I understand that you're into women healthcare facilities. Take us through the business model and how expanded is the your business is.
Okay, great. Hi. Gaudium IVF, I am glad to say, is going to be the first from the IVF industry to be listed on the main board of the capital markets. And I would like to first highlight that the need for IVF is growing and rising by the day with increasing stress in our lives, with increasing lifestyle diseases. We are the diabetic capital of the world. So diabetes affects both the male and the female partner. With all this happening, the need for IVF is rapidly increasing as 15 to 20% of this huge 150 billion population is facing infertility issues. And right now, only 2% is coming forward for treatment, and the rest is a totally untapped market. Gaudium IVF has, worked hard and formed a legacy of 16 years. We were, let's say, born in 2009 when we started a small facility, 800 square footage, but with the highest possible equipment because of my training from both Germany and Australia. And from there, the journey has been very interesting. And 2009 to 2015-16 almost was a journey of a doctor seeking excellence. And we first focused on achieving clinical excellence and achieving success rates which are now have been consistent at 58%, comparable to some of the global best. And achieving these success rates has been possible because, we attract talent, then we train them ourselves. We train our own team in-house, all the doctors, the embryologists, the nurses. So we create the skill. And also, we are completely SOP-driven. So out of the learnings of 2009 to 15, we created SOPs for every possible department, right from clinical, embryology, down to housekeeping. We laid down SOPs so that, we kind of broke down the process of IVF into like an assembly line so that it is totally standardized before we start replicating. Because my mentors in the earlier years told me, who were some leaders of Boston IVF, that if you should replicate only when you're confident that you can deliver the same success rates across all centers without your physical presence. So these SOPs laid down the foundation for that, and that is when we decided that okay, my entrepreneurial journey started somewhere 2017-18, and from that one center in West Delhi, which was the first center was only a couple of years. Then we had a 10,000 square feet facility center, and then we built a state-of-the-art 12,000 square feet facility, dedicated IVF space. And from there, then we started expanding to South Delhi, to Punjab. We have a hub and spoke model. So we create hubs like, for example, a city in Punjab, in Ludhiana, is the hub. There are spokes in the neighboring cities. Then we went to the east of the country. We opened a hub in Patna and spokes around it. We went to the north, Srinagar hub and spokes around it. Mumbai, similar fashion, and then down south in Bangalore. So it is a completely SOP-driven business, delivering consistent success rates within 1 to 2% of each other at various centers. We are 97% B2C driven. So, in an industry which has traditionally been B2B, so we go directly to the consumer, create awareness, and the brand trust pulls the patient. So, this is how we have created the business, and the 16 years of hard work. We have learned from ourselves also and learned from others also, and that is why, after having learned from some people that too many hubs actually adds rapidly to the infrastructure costs, we adopted an asset light model where the hub is where most of the asset has to be created in the form of a lab and OT, and the spokes do not incur any infrastructure cost. It is a trained gynecologist who is trained by Gaudium SOPs. She can deliver the first 10-12 days of injections to the patient, and then the patient comes for the major 2 procedures to the hub, to the nearest hub. So it becomes a win-win situation for the patient who can reach global excellence. Even if they are in a smaller city, it becomes a win-win for the doctor who earns a professional fee, and it's a win-win situation for us because by not putting infrastructure cost, we get a deeper penetration into the state. So that has been our business model, and it is completely scalable. We've already proved that with 7 hubs and 28 spokes, and the main the purpose of the IPO is to open 19 new hubs in the coming couple of years.
Give us a sense of, you spoke about the success rates. Can you tell us what is the kind of patient counts that have come in or grown over the period of time, and what is the success rate that you've been talking about?
Yeah, so see, since the days that I started, the awareness has really improved. I remember that initially when we used to do counseling, so we used to tell the husband to get tested, and he would say, "Oh, nothing's wrong with me." But now at least there is so much awareness that when a couple knows that the husband also knows that he is to be tested. So from those days we have reached these days. The number of infertile patients we have dealt over the years runs into high thousands, and year on year we have shown a robust financial growth of 40% year of year in the past.
And the success rate?
Success rate, yes. So, see, when we started at inception, so the average global success rate, if I remove the age as a determining factor, is it settles down at 40%. Because what happens is that if you're calculating the success rate in late 20s and early 30s, it will go as high as 60-65%, and in the late 40s will go as low as 5%. So the average, global average comes at around 40%. When we started, of course, we started nearing that global average only of 40%, but over the next 4-5 years, we achieved this high of 58%. And believe me, this high of 58, consistency matters a lot in IVF. So, just spiking once in a while to a high success rate and dipping down, that's not the solution. To give a consistently high success rate for so many years of 58% demands a lot of clinical excellence, a lot of focus on SOPs, a lot of quality checks. Gaudium does its own quality checks of the lab every month, though they are sometimes recommended quarterly, we do them monthly. We have a centralized control system, so there's a whole team. I have a chief national embryologist to whom all embryologists report. I have a chief national clinician to whom all the clinicians report. We have a chief operating officer, a chief administrative officer, so that we are very focused on being totally compliant with the law of the land. I must say that the law has come, the ART law that came in 2022 has come as a boon for organized players like us, because going forward I can see that there will be a lot of consolidation that will happen in the coming couple of years. and the unorganized market would decrease and the organized market size would increase.
Give us a sense of the kind of treatment cost that you do, means per patient cost, and how has that fared over the last few years? I'm asking this because you're showing us an EBITDA of nearly 38 to 40%. So just wanted to understand the treatment cost per, and what is the duration of the treatment.
Yeah. Yeah, okay. So the treatment cost, the average base IVF is 2 lakhs a cycle. That is for the fresh cycle, wherein we make the eggs, embryos, and then transfer. And so that is 2 lakhs. And the treatment cost has not really increased too much in the last 3-4 years. So when I had started way back in 2009, it was somewhere around 1,40,000 or so. So with the back end costs of consumable, disposable, injectable rising, there has been a proportionate increase, but then it has been quite stable for the last 3-4 years. And so this is the base cost, and if the patient has a more complex case and additional procedures keep adding, then the cost can go up. So this is how, and we are at par with the some of the best in the industry. And also we believe in one thing very consciously. At Gaudium, we say that, it is, after all, we are making life, we are creating a baby, and there can be no cost to putting to life. So we do not compromise at all. We've never fallen to declaring low-cost packages because a certain standard you have to maintain of the raw material that you are using to create excellent success rates. So we do not compromise on that. And IVF is not a repeat buy, it's not an impulse purchase. A couple goes through this journey maybe once, max twice in their cycle, in their lifetime. So cost becomes a less important factor when you have to realize your motherhood dream.
I just wanted to check with you on the competition part of it also, because you spoke about competition a bit earlier. You have an attrition rate of around 30-31%, which is there. How do you manage resources here? And who are the traditional competitors for you? Are the big multi-specialty hospitals which are the traditional competition for you?
Okay. So attrition rates are actually, the actual attrition rates are not so high. What happens is, as I told you, that we train our own teams. So what happens, we select a good doctor, a good embryologist, a good nurse, for example, through interview. But in an interview, you can only know as much about the person. So when they come for training inside the lab and OT, and then when we actually start training them, sometimes we realize that they are not trainable. So, like 1 month, 1.5 months, 2 months, we tried training them, it didn't work. So we, just say a polite bye, because we do not want to compromise on the quality of treatment delivered. So that is why the attrition looks a little higher. And also the attrition is more at the junior levels, like the receptionist, or support staff, the major people in the company. For example, my doctor in Ludhiana is there since the center opened in Ludhiana, similarly in Kashmir, similarly in Bangalore. So, we all our key people. My chief operating officer is also a skilled pediatrician. She has been with the organization for a very long time. So our director, marketing and strategy, is 30 years of rich experience, ex-Coke, ex-Lipton. He's been there since 2017 with the organization. So at the top level and at the doctor, embryologist level, the attrition is not really there. So we are uniquely positioned because of our clinical excellence, being SOP driven, being led by a leader who is a qualified clinician herself. So innovation is one of our biggest strength. We keep innovating things. We have invested into genome data sequencing recently that is going to help improve the success rates. So all these things make us unique over our competition, and it is the brand that invokes trust and the journey of 16 years of creating babies that invokes the trust of the patient. And we are uniquely 97% B2C driven in an industry which has traditionally been B2B. So that is why our EBITDAs and PATs are so high. One, because of the asset light model which I explained earlier, and two, because we are more directly to the consumer. We do not depend much on doctors referring us patients.
Give me a sense of your receivables here, because you were talking about these packages, and I'm looking at your receivables for the period ended September, where the receivables is around 50.9 crores, while your revenue for the from operation is around 49.49 crores. So how do you recognize your revenues, and why are the receivables very high for you?
No. So basically what happens is that there was a change in the accounting policy, and the revenue recognition is now done as per Ind AS. So the process is broken down into 4 stages. So one is the stimulation, when the injections happen, 25% at that stage. Then second stage is the stage of egg pickup, when we pick up the eggs. Third is when we form the embryos. So we take the husband's semen and the patient's eggs, and the embryos are formed. And last is the embryo transfer. So what happens is that of late, recently, the across the world research is proving that freezing the embryos and then transferring them later after building the uterus in a better manner is giving better clinical success rates. This is known as the freeze-all policy, and it has been adopted by US and Germany in a very aggressive manner. We also started adopting it a couple 2-3 years back, and we saw that the success rates were increasing. So we decided that okay, we should also do this, and hence the step of embryo transfer is delayed and happens later. So some amount of the receivable happens because of that, because the patient is paying stage wise. Also some of this is coming from there's a 90-day cycle. We supply some specialty medicines to the CGHS. So that runs a 90-day cycle. So some of the receivables is coming from there. And the third is that in order to, more patients could realize their motherhood dreams, because we at heart believe that everyone deserves a one of their own. So if you're rich or you're poor, everybody needs a baby. So to support patients, especially after the COVID impact, we took out a scheme where the patient can pay a certain amount which covers our disposable consumable costs, so there is no loss to the company. They pay a certain amount, they get the embryos made, but they come back later, they accumulate money, come back later, get the embryos transferred. So with this we were able to provide services to a larger number of couples. So yeah, that is the thing. And and we love when people are getting benefited.
Dr. Khanna, it was a pleasure talking to you today. Thank you very much for joining us today on ET Now.
Thank you so much.